There are two posters regarding the real-world setting for both relapse refractory ALL as well as for MRD-positive ALL, in which the data were collected. The study is called Neuf study. There will be two posters presented today. Both studies are very important because obviously we can translate what we observed in the clinical trials also in the real-world setting that is usually more difficult to be treated than clinical trials. Regarding the real-world setting for the relapse refractory, 100 patients roughly were enrolled, and what we observed that we could achieve hematological responses in about half of them, and 40% of them also had a molecular response. And this is really perfectly pairing what we observed before in clinical trials. Obviously, the situation is much better for MRD-positive patients. Also, in this case, we could observe molecular responses in 88% of patients, which is a very good achievement. And also, in this case, the results are favorably comparing with what observed before in clinical trials. So this really leads to conclude that Blinatumomab treatment is effective regardless of involvement in clinical trials or in the clinical practice.